All right, we're going to go ahead and get started. Welcome, everyone. Please feel free to continue dropping your name, location in the chat, and share with everyone in the chat section. My name is Sarah Marutra. I'm excited to join you today. I'm a data and policy analyst at Education Trust here in Washington, D.C. on the EdTrust national team, where I work across several issue areas, including on wraparound services. My background is in education research, and I'm excited to facilitate this conversation with you today. I'm seeing responses that have to do with collaboration and holistic, and a couple of responses around safety and participation in academics. I want folks to keep these responses in mind as we go through today and begin defining wraparound services. So what's on our agenda for today? First, we'll share a little bit more about resource equity for folks who are just joining us. Next, we'll define wraparound services. We will then learn about a critical component of wraparound services, including multi-tiered systems of support, or MTSS. We'll then hear from an expert in the field about implementing MTSS in a district. Next, we'll take a look at what comprehensive and equitable wraparound services look like. For those of you who did not get a chance to hear an overview of resource equity, a quick reminder. The Alliance for Resource Equity is a collaboration between education resource strategies and the Education Trust to focus on how schools and districts can best use resources. At the heart of resource equity is schools, systems, and communities working together to make sure they are making the best use of resources to support every single student on his or her path to live a life of their choosing. To meet students' distinct needs with the right combination of supports, school systems need money, but money is not all they need. Students also need dimensions such as strong school leadership, engaging instruction, a positive school climate, and more. These are some of the 10 dimensions of a student's daily experience that school systems can improve, and some of the dimensions of the Alliance for Resource Equity. You'll see the complete list of 10 dimensions listed here. Today, we'll be focusing our discussion on the two in the bottom left-hand corner, student supports and interventions, as well as positive and inviting school climate. We have a few goals for today's session. First is to learn about why wraparound services are critical to COVID recovery. Next is examine the fundamental components of wraparound services. And finally, to hear from an expert about implementing MTSS in a district serving students of color and students from low-income backgrounds. Throughout this presentation, you'll hear me reference SEED, and I know my colleague Nancy did in our first session as well. At the heart of wraparound services are student social, emotional, and academic development, or SEED. All learning is social and emotional. Social, emotional development and academic development are inextricably linked to the overall school context in which students develop and the relationships they build over time, which is why these wraparound services are so critical. But why now? Why are we talking about wraparound services in this moment? The answer is that we are seeing headlines again and again and again across the country about student mental health. We know that school closures, the rapid shift to online learning, instability between in-person and remote learning, and lack of socializing during the pandemic, as well as students' families being impacted by the health consequences of the pandemic, mean that students are greatly impacted in terms of their mental health. Schools across the country are experiencing a dramatic increase in mental health referrals. So what are wraparound services? Wraparound services are literally a way to wrap around a child with the community in order to meet their needs. The theory of action is when schools can identify and provide targeted supports to each student, when the health and well-being of students are met, and when efforts are made to ensure that students feel like they belong, they can better engage in schools, which leads to a more positive social, emotional, and academic development. You'll often hear about wraparound services in conjunction with multi-tiered systems of support, or MTSS. MTSS is the skeleton for wraparound services, the vehicle in which a district provides services and a core structure. MTSS is necessary but not sufficient to meet student needs. There are other components that schools and districts and states need to focus on to wrap around a child in order to meet their needs. The way in which wraparound services are implemented really matter. In addition to MTSS, what else do schools need to do to provide equitable and comprehensive wraparound services? These are 6 components that schools, districts, and states can provide to ensure students are getting the support they need. First, as we'll chat more about, an equitable and data-driven MTS system. Next, health, housing, and medical supports that meet students' basic needs. Equitable and inclusive learning environments, a state council or commission for children, a focus on nutritional justice and equity, and finally, access to school counselors. We'll learn about all of these today. Given how prevalent MTSS systems are, and given that they are one of the main vehicles most districts use to provide wraparound support, we'll start by looking a little bit more closely about how they can be implemented with fidelity. By way of background, a multi-tiered system of support is a proactive and preventative framework that integrates data and instruction to maximize student achievement and support student social, emotional, and behavior needs from a strengths-based perspective. MTSS offers a framework for educators to engage in data-driven decision-making related to program improvement, high-quality instruction and intervention, social emotional learning, and positive behavioral supports necessary to ensure positive outcomes for districts, schools, teachers, and students. The MTSS framework is comprised of 4 essential components: screening, progress monitoring, multi-level prevention system, and data-based decision-making. I'm so excited to take a minute to ask, what do these systems look like in implementation? And in order to get that question answered, I'm excited to welcome Carmen Williams to talk more about these systems. Carmen is a doctoral candidate in education leadership at the Harvard Graduate School of Education and is a superintendent in residence in Medford Public Schools in Massachusetts. She was previously an elementary school teacher and middle school principal, where she implemented an MTSS model and where her work was expanded across the district. She has over 20 years of experience in education. Welcome, Carmen. I'm going to go ahead and stop sharing my screen so that we can have a discussion. And as we're having a discussion, please drop your questions in the chat, reactions, because we're going to save a couple minutes at the end to get those questions answered. All right, so hopefully everyone can see Carmen, and it's great to see you. Thank you for joining us today.
Thank you, Sarah. It's a pleasure.
So let's get started and have you just introduce yourself and tell folks a little bit more about where you're coming from and your background in education.
Absolutely. As you mentioned before, I was an elementary school teacher and middle school principal in South Bend, Indiana. You all might be familiar with Notre Dame or Mayor Pete Buttigieg, but that was my hometown, and I was born and raised there. As a principal, we found that there were so many welcoming spaces for students. It was a very diverse community. And so I don't think anyone really wanted to believe that problems were more than a teacher could handle. But we found, and this was before the pandemic, that though teachers had a lot of heart, a lot of care and concern for their students, they didn't always have the tools needed to meet the needs that they were seeing. And while we all somewhat had a hunch about that, we really couldn't do anything about it until we were able to access data. And so data has been a huge part of my life in driving the decisions that I make. The framework that you shared is clear. So now I am in a position where I'm pursuing more leadership roles, hopefully superintendent one day, where I will be able to support others in finding and utilizing the right tools, data, and providing educators with enough training to know how to support students and connect them with wraparound services.
Thank you so much, Carmen. And so what things in particular, as you were working in South Bend, in addition to teachers needing additional support, made you really think about the need for MTSS services?
Absolutely. My middle school had about 650 students, and it was very diverse. It was about a third of our students were African American and a third identified as white. And we were really proud of the diversity in our building. But after looking at discipline data as a staff, we began to see trends that are often seen across the nation. We were suspending boys. We were suspending students of color, and we were suspending students with identified special ed needs. And while we know we're not going to blame students, a path forward really wasn't clear at that time. So we tried PBIS. Perhaps some of you have heard of that, positive behavior intervention supports. And that was great for helping us achieve a climate and culture for tier 1, right? And so we had this universal understanding and agreement of the rules we were going to follow and how we would incentivize students who were making gains with the universal approach. Yet still, in our tier 2 and tier 3 populations, we continue to see students of color and students with special education services. And so that is when my staff began to get curious about restorative justice in education. Restorative justice is also a tiered program, but the tier 2 interventions and the tier 3 interventions were something that we felt had a little bit more meat, were more tangible to teachers, and we could work with our community to determine appropriate supports for that. So the first thing we had to do was get everyone trained, which costs money. Resources are important. So I went to our school board and wrote a proposal for a restorative justice coordinator in my school. And we started with the staff. Before we said this was good for kids, we said we need this, right? We need a vehicle rather to build community amongst ourselves, to heal. And I say to heal, and I want to double click on that, because educators who are working as hard as they can and feel like they're not doing enough for their kids are hurting and they need healing. And so restorative practices gave us a vehicle to come together in a circle collectively and wrap our arms around one another and be understanding and compassionate and show each other grace as we try to figure out what's best for our kids. We then took restorative practices to our students and families. We trained our parents. We let them know, like, this is what we're doing. Come experience it with us. And so it was important that the entire community be aware. One of the outcomes of having teachers sit in circle with students as a circle keeper, not as the lead, but as a facilitator of powerful conversation, was that, and this was pre-pandemic, that we found a lot of our middle school students were dealing with loss. They had either lost a parent or grandparent, and at that age where they are building their identity, they just did not have the skills to cope or even understand what they were going through. And without having restorative practices, we would not have been aware at the percentage of students that were struggling with grief. And we would not have recognized that there are outside sources that help with that, right? So it's one thing to have a school social worker, that can meet with students one-on-one when they're in crisis. But through this process, we were able to partner with a community agency that had grief circles and group grief counseling for young adults. Again, before looking at data, before committing to a practice and investing resources, we would not have been able to meet distinct groups like that one.
Thank you so much, Carmen, and that is absolutely incredible. I would love to learn a little bit more, knowing what you know about the pandemic and how students have been impacted. Why is it important for districts to be using their funds to implement MTSS services right now?
Absolutely. As you said, there's a lot of news articles and stories about students struggling. And I think that as adults, we can all make some assumptions. But processes like MTSS give voice to the children, right? So as adults, we can always collect data, and that's helpful. But hearing from students and what they're struggling with is really important and takes time. It takes time and it takes personnel. It takes tools, and students who are in districts who have had the advantage of ESSER funding have seen more adjustment counselors in their building, more social workers in their building. But unfortunately, outside facilities are at capacity. Definitely the state where I'm at, there is a waiting list for outside facilities that are supporting students with mental health issues. And so it's really necessary for districts to recognize what % of students are needing support and to equitably allocate those funds to meet that particular percentage of students. This definitely is not a one size fits all. Every student does not need one-on-one therapy. Adults do, but maybe not all students. So just investing in the right diagnostic tools is a really important first step. Yeah.
Thanks, Carmen. And can you talk about more in your experience about working together between schools and districts? That would be great.
Yeah, thank you. Like I've been on both sides of this now. I've been a principal of a building, and now I'm working in central office. And what I can tell you is that unfortunately, communication between schools and central office, typically one-way communication. It is definitely based on communicating mandates and expectations, ensuring that buildings are meeting requirements, both state and federal. And that is unfortunate. So creating space where two-way communication can occur has to be intentional on the part of the district leader. Definitely there's more than one person in central office that can figure out how to be a constant support to schools. But I do think central office leaders need support in building meaningful relationships with their building leaders, just like we want teachers to build relationships with their students, right? And then assessing which of your schools need most support. It won't be every school. You can't just throw cash at every school, but there are ways to build relationships with principals and help them understand from their point of view what the building needs are. And it requires central office to have a very invitational approach to leadership. And I think in times of crisis, people feel like there's no time for that. Like you're constantly driven by needs that should have been addressed yesterday. And so you want to get the job done without really paying attention to the process. And principals need to know that there is a process of support that is consistent for them as well as their students.
I'm sure that you haven't always had the resources to this point about resources to implement an MTSS framework the way you would have wanted to. What might an MTSS framework look like if given proper resources?
Um, with proper resources, we would have diagnostic tools that were readily available. Unfortunately, I think because of No Child Left Behind, there's some confusion about the difference between a diagnostic tool and an academic achievement assessment. And academic achievement assessments have left a foul taste in people's mouths. But we do need regular informal assessments to not only look at students' academic and social emotional learning, their behaviors, but help us understand them from an asset base, right? So when you're looking at achievement scores, it's very much from a deficit, right? Like, are they proficient or are they not? And how far away from proficiency are our students? While having a diagnostic tool can help us look at students through an asset base and say, these are the skills we need to build on. And that's just a completely different opportunity. So I think investment in tools to collect and analyze data is key. The second thing is professional development. We know that teachers across the nation are underpaid, but when you look at different surveys, teachers want to feel like they are professionals. So how do we continue teacher learning and their investment in themselves so that they can develop a new skill set to meet the challenges of the day? We are facing both a health and racial pandemic, and that takes mindset, skills, and some new learning, even for those of us who think we've got it figured out. We want to model that we are still curious and capable of growth. So an investment in educators would definitely be at the top. So yeah, those are my top two if I had all the money to do what I needed to do.
And you've worked with MTSS frameworks in a variety of districts throughout your educational career. Can you tell us a little bit more about how your experiences implementing an MTSS framework or working within an MTS framework has varied in different districts?
Absolutely. Thinking about a district that I was at just recently, I do think it's a struggle for some educators to accept that that children are a victim of their circumstances versus making choices all the time. And so we know the historical context that says that some are more privileged than others, and we need to break down walls and dismantle inequitable systems. Yet, when you're in a conversation with students on a daily basis, especially middle schoolers, you want to believe that they can just make a better choice and everything will be okay. And so I think that's one of the biggest hurdles is helping the adults understand the historical context, their community's context, having a deep enough relationship with their families to have a bigger picture of the circumstances that are surrounding the child and why they're making the choices or not making choices academically and socially that they are. And so because this is still murky, evaluators are not clear on how to support these educators in shifting their mindsets, if that makes sense. And so while evaluators are looking at job performance and whether or not educators are providing safe and effective classroom culture, if they're providing rigorous academic instruction, it is hard to assess the mindset, right, without some serious investment of time. And so I think the districts that struggle with truly investing in MTSS processes are those that haven't completely shifted their mindset to be open enough to not blame students, unfortunately.
Carmen, what are some tangible next steps that advocates who are joining us today can take to really push for MTSS in their schools, districts, or states?
I think the next step or the first step should be, what are we doing with data? I know that after remote learning, people have even less confidence in their data sources, right? So we know that students may have felt detached from their classroom experience, or teachers felt like they weren't able to deliver material in the way they had in the past. And so we don't want to rely on traditional standard academic achievement assessments. And so we have to be creative. We have to figure out, what are the ways we can collect meaningful data? Who needs to be a part of our analysis process? It has to be very inclusive. So if the teachers, the social workers, the paraprofessionals are going to be working with the students, they have to be a part of that conversation of what now, based on a collection of data that makes sense. So that might be climate surveys given with a Google form. That might be an NWEA assessment or samples of classroom work. We can be more creative with how we're collecting data, and the collective group that's analyzing and making decisions with that.
Thank you so much, Carmen. We're gonna, we have a couple minutes for some questions. There's been a few from folks. So one is, there's a question around corporal punishment. I know you brought up restorative justice practices at the beginning of our conversation. How can choice of discipline approaches affect culture and students' experiences of the school as a supportive place?
Okay, that feels like a lot. So though I believe there are a few states where corporal punishment is legal, it is not recommended at all. And I do think, corporal punishment or not, this idea of punishment is something that is very ingrained in our system. Punishment is about control. Oh, I see someone said there's 19 states. Okay. Punishment is about control, controlling the body and the mind. And unfortunately, education is supposed to be about liberation. It's supposed to be about opportunity and access and freedom. And so corporal punishment or punishment of any kind and education really do not go hand in hand. I hope I'm answering the question, because it was a lengthy question. But this is one of those mindset shifts, right? Like, we have habits, ways of doing things, and precedent that are hard to break away from. It takes courage. And I think, I think it will most likely take a coalition. So the approaches that affect culture or help to shape student experiences are really important. But I also have to say, there is a way to include students in that process, right? And so we are all motivated by something. And to ask students, what motivates you? Why do you do, what are you doing? Like, how are things happening from your vantage point? What types of support do you need? Those are the types of questions that are culturally sensitive and culturally responsive, no matter who the child is. Invest in a relationship. I think that's the answer. Invest in a relationship. Was that
Thank
clear?
You, Carmen.
Okay.
I think so. And I think we have time for one more question. What political challenges did you face when you were implementing this MTSS framework? And I think along with that, what was your approach for creating the context and climate within your school for focus on well-being for students of color and students who are underserved?
Okay, so I think the first part was about the political side of this. And I can tell you that it was a grassroots movement. So we had field placement teachers assigned to my building. They were in a teacher prep program, and they were learning about restorative justice as a support to students in their college courses. When they came to my building, they practiced circles in our classrooms, and our teachers, our tenured teachers, were in awe. They absolutely loved that this process of circle was able to build community so deeply and quickly amongst their class who had been together already, right? But it was a connection on a different level. So because the teachers were excited about it, they brought it to me. And then I was able to create a proposal and take it to our school board. We were honored by the opportunity to establish a position of restorative justice coordinator as a pilot, and we were very transparent with our processes. It was a slow go, and because we were trying to inform and make sure it was invitational, teachers didn't have to do this practice. They were invited to and wooed, if you will. And so we wanted to be explicit with implementation as well as outcomes. We then took all of that wonderful data to other schools and shared our practice. And because so many other schools were interested, the district decided to invest in a district-wide restorative justice coordinator. And so it was grassroots. It started with those who were closest to the students and cared the most and were desperate for answers. And so politically, as districts are looking for what's next, talk to your teachers, talk to your parents, and definitely talk to your students because they have real in-time data that needs to be shared. And then there was a second part, but I don't recall it.
That's okay. Because I'm learning so much, I want to see if we can ask you just one final question to end on. What did success look like to you when, and how did you know that you were successful when implementing this MTSS framework?
Okay. Success for me was a few things. Number one, being able to share our work my work as a principal district wide, and it's spreading like wildfire. But one of our parents that was part of this school had a sixth grader and came to a family night and sat in circle. Absolutely loved it. Asked to be trained during our next training, and now does community circles across the city. And so it wasn't just the school community taking this on. Restorative justice proved to be good for our entire community. And so the fact that parents elected to be trained and then took this practice into the community just kind of speaks to its power. So yeah, I think that's one of my proudest moments.
Thank you so much, Carmen, for joining us today. I know we've learned so much from you and appreciate the opportunity to ask you these questions about your experience. I'd love for you to share your email, if you're willing, in the chat so folks can reach out if they have any additional questions. But thank you so much, and we're excited to have you at future EdTrust conversations.
Thank you very much, Sarah, and everyone else who has participated as a participant. I am putting my email in as we speak and would love to continue the conversation offline.
Wonderful. Thank you, Carmen.
Thanks.
So with our remaining time today, we're going to continue thinking about other critical components of MTS systems in addition, of wraparound services, in addition to the components of an MTSS system that Carmen just mentioned. So let's start by diving into a poll. So to the best of your knowledge, does your, there we go, I launched it. To the best of your knowledge, does your school district provide any health services to students beyond the school nurse? Let's take a minute to answer that question. All right, so I'm seeing a mix of responses. I'm seeing most people or many people are unsure. Some folks have said no, and others have said yes. So for those of you whose schools or school districts do provide health services, it'd be great to hit in the chat to just share what those health services are. And while folks are doing that, I want to share a little bit more about the next critical component of equitable wraparound services: health, housing, and medical support. So schools are one of the primary places that parents use, where parents get information about services available to their child, and also a place that parents and families trust. In addition, we know that students cannot learn if they are not getting their basic needs met. In order to make sure that students are getting their basic needs met, states should have policies and practices in place to ensure districts are providing health and housing supports, including authorizing the use of Medicaid for health services delivered to any Medicaid-enrolled students. Medicaid provides health services to students living in poverty who wouldn't otherwise have access to doctors. As some of you may know, under the Individuals with Disabilities in Education Act, or IDEA, schools are obligated to provide medically necessary services to students with disabilities. However, states can go one step further and provide services to all students who qualify, regardless of disability status. In addition, of increasing importance is oral health in schools. Poor oral health can have a detrimental impact on children's quality of life, their performance at school, and their success later in life. Evidence-based school salient programs have been proven to be an effective way to reach students who are less likely to receive private and often really expensive dental care. The state should have guidance or state-level resources for providing oral health supports to students. In addition, states should also ensure that all students and caregivers have information on students experiencing unstable housing by providing information on state, district, and school education websites about essential services and resources for students experiencing homelessness. There are some states who are stepping up to provide these services to students, and one bright spot example comes from Illinois. Illinois has a required dental screening requirement for students entering in kindergarten. But that excludes students who aren't able to afford private dental care. A new law in Illinois provides schools with expanded dental services. The new law provides dental services for students during the school day, including teeth cleaning, cavity fillings, and other dental needs at no extra cost to families. So these dental services provided at schools are through local dental professionals, and the cost of the program is completely covered by Medicaid. We encourage state and local advocates to push for similar kinds of legislation in their states. Another critical component of wraparound services are equitable and inclusive learning environments. All students deserve a school environment that protects and celebrates their identity. However, specific groups of students, whether due to historic or current racism and discrimination, experience inequitable learning environments. 2 data points to share. First, as you'll see on the slide here, 56% of LGBTQ+ students experience discrimination at school. And these students are more likely to be disciplined than those who do not experience discrimination. Second, we see that there are more than 250 anti-trans bills introduced in state legislatures across the nation. States must have policies in place that set the conditions for districts to ensure equitable and inclusive learning and extracurricular environments. This includes anti-bullying policies that underscore groups of students most likely to be bullied and harassed. It also includes policies supporting transgender K-12 students for participating in athletics and using facilities based on their gender identities, for example, bathrooms or locker rooms. Local advocates have a role to play as well. They can ask their local school and district whether they have alliance groups for students, such as a Gay Straight Alliance, available on campus. Let's pause for another poll. Using your best guess, how many states across the country have a policy that protects students against school lunch shaming? Let's take a minute to get that answer. For those of you who don't know, school lunch shaming is either denying a student access to a meal or stigmatizing them by publicly shaming them, making them work for the meal, having them stay after school, or being labeled as I wasn't able to pay for my lunch, something like that. Let's take another minute. All right, so it looks like the most popular response was 11 states, which is correct. Across the country, there are 11 states who have an actual policy in place that protects students against school lunch shaming in any form. This brings us to our next critical component of wraparound services, nutritional equity. Prior to the pandemic, even prior to the pandemic, schools were a central player in nutrition. The free and reduced price lunch program served 21 million children across the country. Additionally, a wide body of research tells us that food security is associated with numerous positive outcomes, including increased attendance, test scores, and the ability to fully participate in school. Yet in some states, students still face barriers to accessing healthy meals when they cannot pay. Black students, Latino students, and students from low-income backgrounds still experience food insecurity in our nation. People of color are more likely to live in food deserts, and as a result, many students don't have access to the necessary nutrition for their growth. During the pandemic, food insecurity, particularly among households of color, skyrocketed. No student should be denied access to a hot meal. Yet, as we saw in the previous poll, only 11 states across the country explicitly protect students from school lunch shaming when they cannot pay. Rhode Island, spotlighted here, is an example of one of those states, but so many others still have a long way to go. Our recently released guide, 5 Things for Advocates to Know About Equitable School Nutrition, shares advocacy tools for state, district, and local advocates. Of note, this includes going beyond providing school meals. It also includes asking your school how they are disseminating information about breakfast and lunch to community members, how they are encouraging school districts, or whether they are encouraging school districts to enroll in community eligibility provisions, and inquiring about how schools are providing summer meals to kids. As some of you may know, summer is one of the hungriest times for students across the country. There are a couple of bright spots. Some schools are using their federal stimulus dollars to ensure that all students have access to meals. We know that across the country, we're facing labor shortages. What this means in practice is that some schools are serving some of the back pantry items during school lunch, meaning that they're not giving students the most healthy options available. Other schools and districts are even canceling school lunches because they don't have enough supplies. But states and districts are stepping up to use their federal stimulus money to confront these challenges. For example, North Carolina approved a plan to confront one of the highest vacancies of rates of food service workers by giving public schools in North Carolina over $10 million to help them recruit and retain food service workers. Similarly, the Maryland Board of Education approved at least 2 districts to provide incentives and additional funds to nutrition and food service workers. In Utah, the Utah State Board of Education Child Nutrition Program is working with community partners such as Utah Against Hunger, Getting Healthy Utah, No Kid Hungry, and other intergovernmental agencies to meet the needs of students who are food insecure and at risk. The next critical component of wraparound services is adequate school counselors. School counselors provide critical social, emotional, and academic supports for all students. In particular, students of color and students from low-income backgrounds benefit from having access to school counselors. For example, research tells us that Black students are more likely than their white peers to identify their school counselor as the person who had the most influence on their thinking about post-secondary opportunities. The American School Counselor Association recommends that schools maintain a ratio of 250 students per 1 school counselor. However, across the nation, the average student to school counselor ratio is 464 to 1. And in our EdTrust Social, Emotional, and Academic Development Scan, or SEED scan, we found that not one single state mandates that schools have the suggested ratio of 250 to 1. The closest to even getting to this ratio was Missouri, where 1 school counselor to 301 students was recommended. Some states are stepping up, given recent mental health crises, to incorporate more student counselors into their schools. Ohio, for example, is recommending that school districts invest in partnerships with community mental health providers to offer students mental and behavioral health services virtually or in school buildings. Georgia is directing schools to use federal dollars to train school counselors, social workers, and nurses. And Maryland is developing a school mental health response team to address the needs of students who have experienced difficulties during the pandemic and are stressed beyond their ability to cope. The last critical component of wraparound services is a state or district level children's cabinet. A children's cabinet is a cross-systems coordinating body brought together to collaborate among intergovernmental agencies, nonprofits, and other private or public groups. A strong and effective children's cabinet can improve coordination and efficacy among state departments and local levels of government. It can mobilize resources around a state's priorities for children and facilitate a holistic approach to serving kids. So before we close out for today, I want to mention 2 things. One is that, as my colleague Nancy chatted about in the first session, we have an exciting new tool about how your state is promoting and prioritizing wraparound services. We'll drop the link in the chat, but I encourage you to take a look and see how your state is measuring up on each of the dimensions of wraparound services that we chatted about. Second, since this is the last session today, we're asking that you take a few minutes right now to complete our feedback survey. We really do use your responses to ensure that these workshops are as helpful as possible to you. And as an incentive, 4 respondents who submit will be randomly selected to receive a Visa gift card. So please do take a minute to complete the survey before you close out for today. If folks have questions about wraparound services, please do drop them in the chat. We'll be posting these slides and these recordings to our website after this, so everyone will have access to this information. And again, please just take a minute right now to complete this survey. And after you've had a chance to complete the survey, we can close out for today. Thank you so much, everyone, for joining. And we look forward to chatting with you again soon.